Hi, everybody. I'm Claire Simeone, and I'm here with two awesome veterinary colleagues. I'm here with Dr. Andrés Granados-Zapata and his co-author and mentor, Dr. Gabriela Hernández-Mora. And so welcome to you both. It's great to talk with you.
Thank you for this opportunity.
So Dr. Granados-Zapata, you're associated with the National University of Costa Rica, and Dr. Hernández-Mora, you're associated with SENASA, the National Animal Health Service, also in Costa Rica. And yes, you guys have a great new paper that's just recently come out, a scientific article in the journal Oceans that's part of the special issue on marine mammal health. And it's open access, so anyone can read it in full, and we'll provide links to that as well. And so I'd love for you to tell us a few things about it. So first of all, the title is really complicated, and so I know we're going to have to break it down, but the title is Pathological Studies and Postmortem Computed Tomography of Dolphins with Meningoencephalomyelitis and Osteoarthritis caused by brucellosis. And so we're definitely going to want to break that down and make it simpler. This is work with dolphins that strand along the coast of Costa Rica, and it focuses on brucellosis, which is an important bacterial disease that can infect dolphins, humans, and a variety of other animals. So Gabby, can you tell us about this disease and how it affects the dolphins that strand along the coast of Costa Rica?
Yes. We have been studying this infection in cetacean since 2004, and we have demonstrated by cultivating this bacterium from the brain of these animals that this infection is prevalent in the stranded striped dolphins, but is also present in other species like common dolphin and dwarf sperm whale. In total, 10 species inhabiting Costa Rican waters have been positive results on the blood or serology, but we are talking about 10 species out of the 30 that inhabit Costa Rican waters. So if you think this infection of this bacteria, because Brucella is a bacteria, and if you think this inflammation of the brain causing some problems in these animals, make perfect sense that these animals have to come ashore. And these animals come really, really affected. So unfortunately, they die like within hours after the strand. So this is a disease that is really causing some impact in the population in the Eastern tropical Pacific. This infection also causes reproductive problems. So also it's affecting in this way in the population because they can be with abortions or some inflammation in the placenta or in the testes of the animal. So this is really important in population dynamics.
Thanks for that, Gabby. Yeah, it's so interesting that it's a very important disease, not just for an individual animal, but yeah, on that population level as well. And your study that you published is really putting some important pieces together. So you published this study that combined pathology, or the traditional study of tissues after an animal dies, with some advanced imaging techniques using CT scans. And so, Andres, can you describe the findings of your study? What's the most important thing that you want your audience to know?
Yes, for sure. Our study includes 18 stranded dolphins. A necropsy was performed to all of them, but before we performed the necropsy, 12 dolphins were scanned by postmortem computed tomography, as you said before, PMCT, as a complementary tool for describing neurobrucellosis and osteoarticular alterations associated with brucellosis infections. The central nervous system and skeleton of 5 dolphins not infected with brucellosis didn't reveal alterations by PMCT scanning. And in other side, 7 Brucella infected dolphins showed at least bilateral ventriculomegaly associated with hydrocephalus. And we found an accumulation in cerebrospinal fluid in the lateral ventricles, and 2 of them presented as well osteoarticular alterations. Also, we performed some grading of the inflammatory processes in the different areas of the central nervous system, and we evaluated the thickness of the inflammatory cellular infiltrate, especially in the meninges and the perivascular cuffs. The results for the severity grading were graphed in charts to provide an injury profile associated in 11 areas of the central nervous system in each case. The most important thing that we want our audience to know is that we consider that when one finds a dolphin with ventriculomegaly, there is a great possibility that these alterations is accompanied by meningoencephalitis caused by brucella.
That's a super important point for all of those folks that are around the world that are responding to stranded dolphins, and that, you know, if they have access to imaging like CT and they can find these changes, that can really help direct them on the rest of their investigation. So that really has the potential to help people around the world in their investigations. That's great. And speaking of, you know, international, you guys have an international team of authors on this paper from Costa Rica, Hong Kong, the United States. There's a lot of areas of expertise that came together with this study. Gabby, so what's something that you learned while pulling the study together or while writing it up?
Yes, definitely. Collaborations are really important to make complex approach like this study. Every part have their expertise, so that it's really important to exploit all the information, to use all the information to describe better, especially this barely is new, this disease in the literature, but it's been there for millions of years. So the approach is really important to be as detailed as possible, and that collaborations make it possible.
Yeah, they absolutely do. The collaborations really make it possible because everybody's bringing that piece of their expertise to learn something new that that maybe you had noticed that one of your colleagues in Hong Kong brought something else to the table. Yeah, it helps to piece together those really old mysteries. That's exciting. And exciting. So Andres, congratulations. This is your first author publication. Congratulations. That's a big step. Can you offer one piece of advice to viewers if they might want to follow in your footsteps?
Yeah, thank you very much. This is not only my first publication as first author, but also the first time that I participate in a publication. I'm very grateful to the entire team that was part of this investigation, and I know that each one worked very hard. My piece of advice would be that you shouldn't be afraid to knock the doors of the researchers that are around you, who are very passionate about their work and who they enjoy the research. In my case, Dr. Gabby was my guide and always had the vision to get here, as well as Dr. Rocio, Dr. Elias, and Dr. Edgardo Moreno. They were a key to this publication.
Oh, you've got great mentors. That is awesome. I'm so glad that, and hey, coming out with a really great publication as a first one and as a first project, that's fantastic. Excellent. All right. So to wrap it up, you know, I know that when folks interview celebrities, it's like, okay, what's the thing in your bag? Like, what do you always have in your purse when you're traveling around? And so it's obviously our work is equally as glamorous. So Gabby, tell us, what's one item that you always have in your field bag when you respond to a stranded dolphin?
A needle and a rose Bengal test.
Oh, okay. And tell our audience why, what are you
okay. So the rose Bengal test is the test actually for brucellosis, that it works in humans or terrestrial animals and works in cetaceans. So that's a key diagnosis that we can do it on the beach directly with the animal. So needle, because we take blood with it. And so with the serum, we perform the test. So this is a key, at least here in Costa Rica, is a key test to make on the beach.
Oh, and you do it right there, and you've got your information. It's very glamorous. That's an excellent thing to have in your bag.
Yes.
Well, thank you guys. Thank you guys both so much. Congratulations on this publication. I'm so happy that it's part of the special issue on marine mammal health. And we'll share the link. Good luck in all of your next work, working to learn new things about marine mammal health. And we look forward to catching up with you soon and hearing what you're up to next.
Thank you for the opportunity.
Thank you so much. Goodbye. I hope you enjoyed the paper.